Today's press conference is about men's health, men's awareness, and sometimes lack of awareness and lack of paying attention to small details and actually doing what we're supposed to do when the insurance companies tells you this is what you have to do. So again, thank you for joining us in our initiative to help with the men's health right here in our state. Even though we are public servants, we are here to talk about our personal lives. All of us have in some form or shape or another dealt with or are currently dealing with prostate cancer. I had surgery on July 14th, and this is my first full day out. This is the first time I put on a suit jacket since July 14th. We deal with prostate cancer a little bit different. It's not something you go and you're not doing cartwheels and you're embarrassed, you're concerned. You start, your whole life starts flashing before you. Start thinking about, I'm too young. And the age has nothing to do with it. My journey started when my insurance basically pretty much forced me to go and get one more screening test that I had done 2 years earlier. But I am going to credit the medical teams, my doctors, and the science for actually probably saving my life. I'm a Hispanic male, and we are very stubborn, tend to think to know better, and left to my own demise, this could have been different. I was very apprehensive, pushed it off, like I said, for time. I'm grateful that the insurance carrier was persistent, because when I went for my checkup, I was diagnosed with prostate cancer. I have already undergone surgery, and I'm currently in recovery, which is another entailing set of details. You're looking at life differently. You're looking at things that were so important last week are no longer that important, and I just wanted to share that for all of our constituents here in the state of Connecticut, do not ignore signs. Please go and get your checkup. And I started really thinking even more so about the poor people that don't have medical insurance and can't even do anything about it. So there's a block of people that are already in harm's way. And from the data I have in Connecticut in 2020, there were 2,680 new cases of prostate cancer, and there were that same year, 367 men died of prostate cancer. So I say this simply to bring awareness that prostate cancer, although almost every one of us was told it's mild, it's not aggressive. From the time I was diagnosed to the time I was operated, it's 14 months. Former Representative Yacarino, who unfortunately couldn't make it, from the time he was diagnosed to the time he was operated, 18 months. And he actually served the whole session with prostate cancer. I was at the tail end of mine. But Representative Ziogas, former Representative Ziogas from Bristol, he served a term with prostate cancer. And the reason that we are here is very simple. It's mental health, it's men's health, and we need awareness for this prostate cancer, which in many cases is very treatable, and we can lead normal lives, but we have to pay attention to the science, and we have to really listen to the doctors. And I think at the end of the day, I have some valuable lessons that I learned in the last 30 days and the last 40 days. And one of the important things I had in my mind, short-term goal, was to run for mayor of the city of Waterbury. I gave up on that about 3 months ago, but I haven't been able to verbalize it because between my body, my heart, and my mind, it didn't connect. And I cannot run for the city of Waterbury or mayor of anything, because right now I need to stay alive for my family, and working for the state of Connecticut as a state representative is a full-time job, something I don't take lightly, and it's a very important message that I want to get out, and I'm going to do some more messaging to the Hispanic community as well.